Good day, everybody. Welcome to our rationalization for LT3, which is focused on nursing practice 2, care of healthy at-risk mother and child, which is also specifically subdivided into care of pediatric client with respiratory disorders. Let's have question number one. How does a nurse interpret the laboratory analysis of a stool sample containing excessive amount of azoturia and steatorrhea in a child with cystic fibrosis? The values indicate the child is A, non-compliant with taking her vitamins, B, non-compliant with taking her enzymes, letter C, eating too much foods high in fat, letter D, eating too much food high in fiber. Of course, eliminate natin kaagad yung letter D because we know that azoturia is an increased amount of protein in the stool. And on the other hand, steatorrhea is an increased amount of fat in the stool. And neither is a result of eating too much high in fiber. So letter D, eliminate. And then letter C, eating too many foods high in fat. That is steatorrhea. It's actually steatorrhea is an increase in the amount of fat in the stool. However, for patients having cystic fibrosis, it is not a result of eating too many fatty foods. So C and D eliminate. So we're left with letter A and B. So the best answer for number one is letter B, non-compliant with taking her enzymes. Because of course, if the patient or the child is not taking enzymes, it will result to a large amount of undigested food, and that includes azoturia, which is actually protein, and steatorrhea, which is actually fat in the stool. So for patients having congestive heart failures, the pancreatic ducts become clogged with thick mucus that possibly block the flow of digestive enzymes from the pancreas to the duodenum. Therefore, these clients or these kids must take digestive enzymes with all meals and snacks to aid in absorption of the nutrients. And of course, we know that teens are non-compliant with their medication regimen because they want to be like their peers. So letter B is the best answer. And of course, we also know that letter A is wrong because even if the child is not compliant with vitamins, it will not be reflected in the laboratory results, such as the manifestations of azoturia and steatorrhea. So if the client or if the child is actually not taking his or her daily vitamins, then it might actually result into a deficiency of that vitamins. But here we're talking about the enzyme. Number one, bravo. Two, which would a nurse explain to parents about the inheritance of cystic fibrosis? A, CF is an autosomal dominant trait passed on from the child's mother. B, CF is an autosomal dominant trait passed on from the child's father. Letter C, the child of parents who are both carriers of the gene for cystic fibrosis has a 50% chance of acquiring CF. Or letter D, the child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. Of course, we know that CF is an inherited autosomal recessive. So letter A and B eliminate because we talk about dominant. So when you say recessive, both parents must be carriers of the disorder in order for their child to inherit the disease. And if both parents are carriers of the gene, each child they have has a 25% chance of acquiring the disease and a 50% chance of being a carrier of the disease. So if the child is born to be a parent with CF and the other parent is carrier, the child has a 50% chance of acquiring the disease and a 50% chance of being a carrier of the disease. So letter A and B eliminate because it says it's autosomal dominant. So we're left with letter C and D. So of course we know that it is actually recessive. So letter C eliminate because if the child is born to parents who are both carriers of the gene of the cystic fibrosis gene, the child has 25% chance of acquiring the disease and 50% chance of being a carrier of the disease. So that's actually wrong. So the best answer for number two is letter B. The child of a mother who has a CF and a father who is a carrier of the gene for CF has 50% chance of acquiring cystic fibrosis. So that is 50%. So number two, bravo. Three, the parent of a 4-month-old with cystic fibrosis asked the nurse what time to begin the child's first chest physiotherapy or CPT each day. Which is the nurse's best response? A. 30 minutes before feeding the child's breakfast. B. After deep suctioning and child each morning. Letter C. 30 minutes after feeding the child's breakfast. Or letter D. Only when the child has become or has congestion or coughing. Letter D. Eliminate, because only is actually absolute. So chest physiotherapy should be done as a daily regimen with all patients with cystic fibrosis, and that chest physiotherapy uh, break breaks up the secretions in the lungs and makes it easier for the patient to clear those secretions. So letter D, eliminate. And letter A and C are actually opposing. So is it before or after? Of course, the ruling is the chest physiotherapy should have to be done before feeding. When it is actually done following feeding, it might increase the possible likelihood of the child to have vomit, and there's a possibility of aspiration. So number three, the best answer is letter A. Letter B is wrong because infants with cystic fibrosis uh, are not routinely deep suction. So they might need occasional suctioning because of their very weak cough reflex. And of course, the chest physiotherapy will stimulate them to cough. Number three, the best answer is alpha. It should be done prior to the morning feeding. That is to avoid the possible vomiting and the possibility as well of aspiration. Three, alpha. Four, the parent of an infant with cystic fibrosis asks the nurse how to meet a child's increased nutritional needs, which is the nurse's best suggestion. A, you may need to increase the number of fresh fruits and vegetables you give to your client infant. B, you may need to advance your infant's diet to whole cow's milk because it is higher in fat than formula. Letter C, you may need to change your infant to a higher calorie formula. Or D, you may need to increase your infant's carbohydrate intake. Eliminate letter D because an increase in carbohydrate intake is not usually necessary. And the nutritional recommendation for CF is high in calorie as well as high in protein. So letter D, eliminating natin yung letter A because a child with cystic fibrosis have difficulty absorbing nutrients because of the blockage of the pancreatic duct. That is why uh, there's a need for that is why you know that pancreatic enzymes cannot reach the duodenum to aid in the digestion of the food. So letter A, eliminate. As well as letter B, we'll have to eliminate that because we know that whole cow's milk is a good source of fat, but it is not an increased source of protein that is recommended for cystic fibrosis patients. And another recommendation consideration is that the whole cow's milk is not recommended until 12 months of age. So it's actually infant. It wasn't mentioned on what age is the infant. Best answer is letter C. You may need to change your infant to a higher calorie formula. So often infants with cystic fibrosis need to have a higher calorie formula to meet their nutritional needs, and infants may also be placed on hydrolysate formulas that contain medium chain triglycerides to supply the nutritional needs of the infant. Answer, Charlie. 5. That the parent of a child with cystic fibrosis is excited about the possibility of the child receiving double lung transplant. What should the parent understand? The transplant will cure the disease of CF and allow the child to lead a long and healthy life. Let it be that the transplant will not cure this child of CF, but will allow the child to have a longer life. Let her see that transplant will help to reverse the mortal system damage that has been caused by CF. Or letter D, the transplant will be the child's only chance at surviving long enough to graduate from college. Of course, uh, letter D, eliminate because the average lifespan of a client with cystic fibrosis has risen over the years with a daily regimen of chest physiotherapy, exercise, medications, and at the same time, high calorie protein diets. But what makes this statement wrong is because of the only that is considered to be absolute. And then eliminate din natin yung letter C because the transplant itself will not reverse the multi-system damage that has been caused by cystic fibrosis, and it doesn't offer a chance of a longer life. And also, uh, letter B does not cure. It will not cure the condition. So letter A and B are actually opposing. So the best answer here is letter B. The lung transplant itself will not actually cure the condition, but it actually offer the client an opportunity to live a longer life. And if the concerns are that after the lung transplant, the child is at risk for possible rejection of the new organ and for the development of secondary infections because of the immunosuppressive therapy. Five is letter B. Six. A 2-year-old child has been diagnosed with cystic fibrosis. The parents ask the nurse what early respiratory symptoms they should expect to see in their child, which is the nurse's best response. A, you can expect your child to develop a barrel chest shaped chest. You can expect your child to develop a chronic productive cough. Or letter C, you can expect your child to develop bronchiectasis. Or letter D, you can expect your child to develop wheezing respirations. Of course, letter A, eliminate, because that is specific for clients having uh, congestive heart, chronic obstructive pulmonary disease, or COPD. And then we know also that there will be no prolonged cough for client with cystic fibrosis, as well as uh, the development of bronchiectasis is usually going to uh, happen, especially during the advanced stages of cystic fibrosis. The answer here is delta. So that is considered to be more common among early symptoms of cystic fibrosis. Six is delta. Seven, the parent of a child with cystic fibrosis asks the nurse what will be done to relieve the child's constipation, which is the nurse's best response. A, your child likely has an obstruction and will require surgery. B, your child will likely to be given IV fluids. Letter C, your child will be likely to be given Miralax. Letter D, your child will be placed on a clear liquid diet. Eliminate natin kagad yung letter A, because a client who has cystic fibrosis, uh, if there is actually constipation, it usually does not require surgery. They usually need to receive a stool softener, or basically an osmotic solution, to relieve the constipation. Eliminate din natin yung letter B, because IV fluids may be ordered if the client is actually on an NPO status. However, IV fluids do not relieve the client's constipation, and cystic fibrosis clients with constipation commonly receive a stool softener or an osmotic solution orally to relieve their constipation. And letter D is also eliminated, because this does not place the client should not be placed on a clear liquid diet to relieve the constipation. Cystic fibrosis clients with constipation commonly receive a stool softener and osmotic solution orally to relieve the compression. And once the constipation is relieved, the client will likely be placed on a low fat and a stool softener. The best answer is letter C, because cystic fibrosis with constipation commonly receive a stool softener or osmotic solution, such as your polyethylene glycol 3350 or your Miralax that is given orally to relieve the constipation. Answer here is Charlie. 8. The parents of a 5-week old have been told that their child has cystic fibrosis. The mother has a sister who died CF when he was 19 years of age. The parents are sad and ask the nurse about their child's projected life expectancy, which is the nurse's best response. A, the life expectancy for CF has improved significantly in recent years. Letter B, your child might not follow the same course that the mother's sisters did. See the healthcare provider will come to speak to you about the treatment options. Letter D, the nurse answers their questions briefly, listens to their concerns, and is available later after they process the information. Number eight, the best answer is letter D, because it is the best nurse's intervention to listen to the parents express their concerns and fears. The nurse's answer should be brief, knowing that the parents are not able to process information right now. Thus, nurse should be available later if the parents have any other concerns or questions, or if they have just need someone to whom to talk about it. Number eight is letter D. Nine. A 7-month-old has a low-grade fever, nasal congestion, and a mild cough. What should the nursing care management of this client include? Sila ka apply. Is it maintaining strict bed rest, avoiding contact with family members, instilling saline drops and bulb suctioning, keep the head of the bed flat, providing humidity, and propping the head of the bed? The best answer here is B, 3 and 5 only. So we know that infants are nose breather and often have increased difficulty when they are congested. Nasal saline drops and gentle suctioning with a syringe are often recommended. Then, of course, we also know that number five is also correct. One helpful suggestion for infants with colds are to provide humidity with uh, a cool mists humidifier, or take them into a steamy bathroom. In addition, raising the head of the bed helps with the drainage of secretions. Number nine is Bravo. 10. School age nurse has been diagnosed with nasopharyngitis. The parent is concerned because the child has had or little or no appetite for the past 24 hours, which is the nurse's best response. A. Do not be concerned. It is common for children to have a decreased appetite during a respiratory illness. Letter B, be sure your child is taking the adequate amount of foods. The appetite should return soon. Letter C, try offering the child some favorite foods. Maybe that will become the appetite. Or letter D, you need to force your child to eat whatever you can. Adequate nutrition is essential because, of course, uh, it is for the nutrition, but you should not actually force. And letter C is also wrong because the child will be fine if an adequate amount of fluid is maintained. Answer for number 10 is letter B. It's actually very common for children to have a decreased appetite when they have a respiratory illness, and the nurse is appropriately instructing the parent that the child will be fine by taking in and out adequate amount of fluid, which will keep the child hydrated. 11. A child's parents, as a nurse, what treatment a child will need for the diagnosis of strep throat, which is the nurse's best response. A. Your child will be sent home on a bed rest and should never recover within a few days without any intervention. Letter B. Your child will need to have the tonsils removed to prevent future strep infections. Letter C. Your child will need to take oral penicillin for 10 days and should be feel better in a few days. Or letter D, your child will need to be admitted to the hospital for 5 days of antibiotics. Of course, strep throat can be treated at home with oral penicillin and doesn't require any IV antibiotics or hospitalization. Letter A, eliminate. Letter B, the child may need bed rest. However, the child does need antibiotics to help treat the strep infection. So that's actually going to be wrong. Is it B or C? Answer is letter C. The child will need a 10-day course of penicillin or amoxicillin to treat the strep infection. It is essential that the nurse always tells the family that although the child will feel better in a few days, the entire course of antibiotics must be completed. 12. A child is complaining of throat pain. Which statement by the mother indicates that she needs more education regarding the care and treatment of her child's pharyngitis? A. I will have my Child, gargle with and water 3 times a day. Will offer my child ice chips several times a day. I will give my child Tylenol every 4 to 6 hours. Or I will ask a nurse practitioner for some amoxicillin. Of course, we'll eliminate letter A because gargling with warm water with warm salt water is a recommended treatment to relieve some of discomfort associated with pharyngitis. But there's no pharyngitis here. Letter B is also eliminated because ice chips are recommended to relieve some of the discomfort associated with pharyngitis. And Tylenol is suggested treatment for relief of discomfort related to pharyngitis, but not on uh, inflamed mucosa. The best answer for number 12 is letter D. Pharyngitis is considered to be self-limiting and, and it is a viral infection, but it does not require antibiotic therapy because it's a viral infection. Pharyngitis should be treated with rest and comfort measures, including acetaminophen, throat sprays, cold liquids, and also popsicle. So we're done with the first half. Let's proceed now to the second half, which is all about your cardiovascular disorder. Number 13, which plan would be appropriate in helping to control congestive heart failure in an infant? Promoting fluid restriction, feeding a low salt diet, feeding in semifibrous position, or encouraging breast milk. So, of course, we now hear uh, letter A is eliminated because there's no need for restrictions of fluids. And, of course, letter uh, B also is eliminated. There might be problems with salt, but there is no need for uh, providing low salt in the diet. And then uh, letter D is also eliminated because the breast milk has less amount of sodium than formula milk. The child needs a normal sodium because of the diuretic. So the best answer here is letter C. The infant's rate of difficulty feeding with seizures or even getting the maintenance fluids is a challenge, and the infant is fed in the more upright position, so fluid in the lungs can go to the base of the lungs, allowing better expansion. So that is number 13. 14. In which congenital heart defect or CHD would a nurse need to take upper and lower extremity blood pressure? Is it letter A, transposition of great vessel? Letter B, aortic stenosis or your AS? Letter C, coarctation of the aorta? Letter D, tetralogy of Fallot? So, which of these requires taking BP in both extremity? So, of course, for letter A, transposition of great vessels, BP would not be taken in both the extremities in this condition because the aorta and pulmonary arteries are actually in opposite positions, which does not actually change the blood pressure of the patient. Then letter B, aortic stenosis is considered to be narrowing of the aortic valve, which does not require BP. So A and B has already been eliminated. And then lumbar letter D is also considered to be a congenital cardiac problem with actually four defects, which does not need BP in the extremities. The answer here is letter C, the coarctation of aorta, because there's narrowing of the aorta, which increases pressure of the upper extremities and decreases pressure distal to the defect or the lower extremities. There will be high BP and strong pulses in the extremities and lower than expected BP and weak pulses in the lower extremities. 14 is Charlie. 15. A 10-year-old has undergone cardiac catheterization. At the end of the procedure, the nurse should first assess pain, pulses, hemoglobin, and hematocrit levels, or catheterization report. Of course, we know that the most important way of assessment is actually the pulse. Letter A, eliminate. Pain needs to be assessed but post-procedure, but it is considered to be not a priority. And letter D, eliminate as well, because the catheterization report would be of interest to know what was determined from the procedure, but this would be good to check on the patient post-procedure. So the best answer is letter B, checking for pulses, especially on the cannulated extremity, would assure perfusion to that extremity and is the priority procedure. Of course, we know that hematocrit and hemoglobin levels would be checked post procedure if the child has bleed very much during or after the procedure. 15 is bravo. 16, which statement by the mother of the child with rheumatic fever shows she has good understanding of the care of her child. Select all that apply. 1. I will apply heat to his swollen joints to promote circulation. 2. I will have him do gentle stretching exercise to prevent contractures. 3. I will give him his order antiviral medication. 4. I will apply uh, cold packs to swollen joints to reduce pain. 5. I will take my child every month to the healthcare provider's office for his penicillin shot. Of course, the best answer here is letter B, 3 and 5 only. So letter A is eliminated because during the acute phase, limit any manipulation of the joint and avoid heat or cold. Number 2 is also wrong because during the acute phase, limit any manipulation of the joint and avoid activities. Letter number 3 is correct. Number 4 is also the same as 1 and 2, so eliminate. And we know also that parent will take the child to the clinic monthly for a penicillin injection to prevent recurrent streptococcal infection. So answer here is bravo. 17. A child has been diagnosed with valvular disease following rheumatic fever during patient teaching. The nurse discusses the child's long-term prophylactic therapy with antibiotics for dental procedures, surgery, and childbirth. The parents indicate they understand when they say she will need to take antibiotics until she is 18 years old. She will need to take antibiotics for 5 years after the last attack. She will need to take antibiotics for 10 years after the last attack, or she will need to take antibiotics for the rest of her life. A, B, C, D, eliminate. Because we know that that already involves valvular damage, so antibiotics would be taken for the rest of her life. Answer Delta. 18. A child born with Down syndrome should be evaluated for which associated cardiac manifestations. Is it congenital heart defect, systemic hypertension, hyperlipidemia, or cardiomyopathy? So, letter B, C, and D are not associated with Down syndrome. Because we know that Down syndrome is a genetic syndrome, will actually like to have other abnormalities such as your congenital heart defect. Answer Alpha. 19. The Norwood procedure is used to correct transposition of great vessel, hypoplastic left heart syndrome, tetralogy of Fallot, patentatus arteriosus. Okay, so letter E requires different surgical procedures, and then letter C and D also requires other procedure. But what is specific for Norwood here is B, hypoplastic left heart syndrome. That is specific for the procedure. 20. Child has Glasgow Coma scale of 3, HR of 88 beats per minute, and regular respiratory rate of 22, BP of 752, and blood sugar of 35 milligrams per deciliter. The nurse asks a caregiver about accidental ingestion of which drug. Is it calcium channel blocker, beta blocker, ACE inhibitor, or ARB? So, of course, we know the calcium channel blocker decrease the force of cardiac contraction and slow the electrical conduction of the heart, resulting in slowing the HR. The HR here is normal in this child, so that's not calcium channel blocker. And of course, we know that beta blocker does not only affect heart and lungs, but also blocks the beta size in the liver, reducing the amount of glycogen available for use, causing hypoglycemia. The lower HR and BP also suggest ingestion of a cardiac medication. Then letter C, ACE inhibitors block the conversion of protein from its inactive to active form. The protein becomes constriction of small blood vessels, which raises BP. By blocking this protein, BP is lowered. Or letters D, angiotensin receptor blockers relax blood vessels, which lowers BP and makes it easier for the heart to pump. So in that case, the best answer for number 20 is a letter B. That's beta blocker. 21. Exposure to which illness should be caused to discontinue therapy and substitute di- dipyridamole in a child receiving aspirin therapy for Kawasaki disease is chickenpox or influenza, E. coli or Staphylococcus candida or streptococcus or Streptococcus A or Staphylococcus. So here, that might actually result into Reye syndrome if the patient is actually taking aspirin and has a viral infection. So both chickenpox and influenza are viral in nature. So consider stopping the aspirin because of the danger of Reye syndrome. Here, the best answer is letter A, because we know letter E, E. coli, is a bacteria, and Candida is a strain of fungus, and Streptococcus A and Staphylococcus are considered not viral. Answer alpha. The nurse is caring for an 8-year-old girl whose parents indicate she has developed spastic movements of her extremities and trunk with facial grimace and speech disturbances. This states it seems worse when she is anxious and does not occur while sleeping. The nurse questions the parents about which recent illness. Is it Kawasaki, rheumatic fever, malignant hypertension, or atrial fibrillation? Of course, atrial fibrillation is not an illness, and malignant hypertension does not result in the condition, but it can actually cause chorea or St. Vitus dance. And of course, letter B, chorea can be a manifestation of RF with a higher incidence, and KD does not result in this condition, and that's called chorea or St. Vitus. The answer for number 22 is letter B, rheumatic fever. 20, the most common cardiac dysrhythmia in the pediatric population is ventricular bradycardia, sinus bradycardia, supraventricular tachycardia, or first degree block. So ventricular tachycardia is not common in children, as well as sinus bradycardia. And first degree block is also uncommon, but what is common here is your letter C, which is the supraventricular tachycardia. 23, Charlie. 24, a nursing action that promotes ideal nutrition in an infant with congestive heart failure is feeding formula that is supplemented with additional calories, allowing the infant to nurse at each breast for 20 minutes, or providing large feedings every 5 minutes, or using firm nipples with small openings to slow feedings. Letter D, eliminate, because soft nipples are easy for the infant to suck, would make for less work getting nutrition. Then smaller feedings more often, such as every 2 hours, would decrease cardiac demand, and uh, the infant would get tired while feeding, which increased cardiac demand. Limit breastfeeding to to half hour or 15 minutes per side. The best answer here is letter A. Formula can be supplemented with extra calories, either with a commercial supplement such as the corn syrup, and calories in formula would increase the calories of the food needed. 25. An 18-month-old with a myelomenicoceles going to cardiac catheterization. The mother expresses concern about the use of a dilated procedure. The nurse does not have any allergies. In addition to the concern for an iodine allergy, what other allergies should the nurse bring to the attention of the catheterization staff? Is it soy, latex, penicillin, or data? Of course, we know that that is having a problem with dye and allergies as well of iodine. So the best answer is letter B. because children with spina bifida often has a latex allergy. Latex allergy. The catheter balloon is often made of latex, and all personal care for the child would be made aware. So that's actually the end of our long test 3 discussion. Thank you very much.